Hey, it's Dr. Sean Tierney. Today I'm going to talk a little bit about a problem with the wrist and hand called DeQuervain's syndrome. What that is there's a compartment of the wrist. Look at these little tendons here. There's a tendon you see here, here, and a tendon you see here. So this one is the first compartment of the wrist. This one is the third compartment of the wrist. And there's another compartment you don't see as superficially called the second. But this first compartment is that DeQuervain's tenosynovitis. And that's a complex problem that happens very commonly. Really common if you're lifting up a baby after you give birth or you have a new kid. This is a common problem because you're kind of lifting and stressing those tendons. Now that one tendon is one of the most dexterous, important tendons for as far as your hand and thumb, because it's what we call the abductor pollicis longus, and it's the biggest part of this little bundle. There's actually two tendons in this part that looks like one tendon between my thumb and my index finger here. So that abductor pollicis longus has multiple tendon slips because you have to be able to move your thumb in all these different directions. I call it the Fonzie muscle, Fonzie tendon, right? But hey, I don't remember the Happy Days. Maybe you're too young, but that was a cool show when I was a kid in the 70s. So Happy Days, the Fonzie muscle, the Fonzie tendon, and that is a very dexterous tendon, but it's easy to get hurt because it has all those slips, and if you overstress it, it gets a little bit inflamed. And surprisingly, the injury is usually not that bad. So you have a small injury to that tendon, and you have an explosion of pain and a disability because of it. The reason being, and I think this is poorly understood by a lot of clinicians, but that there is a radial nerve, superficial radial nerve, splits from the radial nerve at the elbow, and part of it goes through the radial tunnel, that's the deep radial, and the rest of it goes down, and it kind of wraps around this portion of the wrist with several branches of the nerve on either side of that tendon bundle, those tendon bundles, and another branch going underneath it. So it's completely surrounded by nerves. And those nerves are right against that tendon sheath. So if you have a little bit of inflammation in that abductor pollicis longus or the extensor pollicis brevis, which is the other tendon in that extends a little bit. So if you have any inflammation, that nerve pain is outrageous. It doesn't even make sense how bad it hurts. So what we tend to do is we look at that tendon with ultrasound. We see the tendon, is it swollen, is it inflamed, is it damaged? Usually the damage is minor, but the pain is severe. So what we end up doing is we end up using fluid to hydrodissect or push the tendon off, the nerves away from the tendon, and have free the nerves from being stuck against that inflamed tendon. And then we'll put some regenerative solution or anti-inflammatory solution into the tendon to take the inflammation down and stimulate it to heal where it wouldn't heal on its own. So that's that DeQuervain's syndrome, excruciating pain. The nice thing about it is that pain is truly excruciating. Usually the common test is you kind of grab your thumb and you kind of deviate your wrist towards the ulnar side. This is the radial side, so we call it ulnar deviation. That would be the test for the DeQuervain's, but I think the pain is outrageous. When we hydrodissect those nerves, a lot of people have significant relief very rapidly, so we can get you out of that very uncomfortable pain. Then we do two things after that. One thing is we have you not lift whatever you're lifting, your child or whatever it is, in this manner. We have you turn your hands and lift everything this way, and you protect that as it heals. It's going to take about 3 months for that to actually heal. But you want to be very careful with how you move and how you use your hands for the next 3 months. It's just a slight alteration, so it doesn't interfere with your life. You usually end up being able to live your life fairly normal, a lot less pain. Well, lots of times we'll put some tape over that area to prevent you from ulnar deviating, and also some rock tape or kinesioelastic tape that increases the circulation to the nerve, especially at night. So we have tapes that we use, we have change the way your hand works. Is there extensive rehabilitation you want to do to that hand? I think maybe not, because if you stress the already injured area, that might make it worse. So it's more of learning how not to stress it as you heal, rather than doing all this rehab to make it stronger. It's a tendon, it's not going to get a lot stronger, it needs rest as it heals. So that's our DeQuervain's syndrome.